Hey everyone, my name is Phoebe and I'm a second year PA student. I just thought I'd film a quick video talking about the difference between PCE and HCE for applying to PA school. I know apps are going to open up soon, so hopefully you find this video helpful. I'm going to talk about the difference between the two because there is a difference and PA schools definitely care. I know when I was first applying and first saw these two terms, I was like, oh, these are the same thing, but they're 100% not, and it's important that you know the difference. And then after I talk about the difference between the two, I'm going to talk about what I applied with and what counted as PCE versus HCE. First, I'm going to talk about PCE because that's the more important one that PA schools care more about. PCE stands for Patient Care Experience, and sometimes PA programs will specifically denote this as Direct Patient Care Experience. And basically what this means is any role or position where you have hands-on, active, face-to-face time with the patient where you're actively involved in their care management. Positions that would fall into this category include being a medical assistant or an MA. Another common one that you'll see is being a paramedic or EMT. You're dealing with patients all day, you see them face to face, often from beginning to end. You're actively participating in their medical care. So these are really good examples of PCE specifically. Some other common roles or positions that you'll see that fall into this category include CNA or Certified Nursing Assistant. Another one is a PTA or Physical Therapy Assistant. Also phlebotomist or someone who administers vaccines would also count. This is where you're hands-on with the patient. A phlebotomist is drawing blood from the patient. If you're a CNA or a PTA, you're directly involved in helping the patient, whether it's with day-to-day activities that they need help with or helping out with PT exercises. You're directly involved in their care. When you think about it that way, hopefully it makes it a little bit easier. Now, this list is not exhaustive by any means. If you're still having trouble kind of figuring out, is this experience that I've already done PCE or HCE, feel free to check out my article on my website, howmedworks.com. I'll link it below. There I have a much longer list from multiple different sources of different roles that count as PCE versus HCE. And then also something else to keep in mind is if you are a different healthcare provider, all of those hours should count. What I mean is if you are working as an RN, all of those hours would count. I actually have a professor that went from RN to PA, which is interesting because I feel like usually they go RN to NP or something like that. But all of those hours in nursing definitely would count. You're working with patients all day, hands-on. Being a respiratory therapist, physical therapist, or occupational therapist would also count. Even alternative medicine like chiropractor and acupuncturist, those would also count as PCE. If you are in that boat, those hours count. I'm going to talk about HCE or healthcare experience. This is a much broader umbrella term for any other healthcare related activities. So what I mean is, for instance, research. Most of the time, unless you're doing clinical trials or something very specific, most research is just basically in front of a computer screen or looking at literature, stuff like that. You're not really dealing with patients, so that would count as HCE. Something else that's really common is any front desk position or receptionist position at a medical office, because even though you're helping scan patients in, you're not really taking part in their medical care. Any kind of dealing with insurance, calling patients, that doesn't really count because it's not their medical care, it's just kind of more support surrounding it. So that would also count as HCE. Shadowing, by definition, you're not supposed to be doing anything with the patient, you're just observing, so that would be HCE. Administration kind of goes hand in hand with the front desk position. You're usually not dealing with patients, you're just kind of overseeing how things run. So that falls into HCE. Lastly, if you are a hospital volunteer, not directly dealing with patients, but you're still in that kind of setting where you're getting some exposure to healthcare, that would also count as HCE. Lastly, I did want to mention there is one kind of grayish area that could fall into either. Usually I found that schools do accept this as PCE. However, there are a few that specifically say that this is only HCE. Just read on their website, or if not, you can always email and double check. They should get back to you within a day or two. They're usually very good about that. But that role is being a medical scribe. You're not really hands-on with the patient, but you are very involved in their care in terms of understanding what's going on. I have found that most schools accept it as PCE. I think pretty much all the schools I applied to accepted it as PCE because it was my main role going into PA school. And I personally feel like I learned the most in that role compared to any of the other ones, even though you could say it was the least hands-on, just because when you're scribing, you really have to understand what's going on. So why is the patient presenting this way? way? Why are we ordering these labs? Why are we ordering these meds? That sort of stuff. So you really have to understand what's going on. Lastly, I wanted to talk a little bit about what kind of positions I had going into PA school and what I applied with. I'm first going to talk about PCE. I started off actually as a dental assistant over a summer where I was literally helping with the cleanings, flossing, deep cleans, kind of small dental procedures, all that. I was very hands-on. I also worked as a surgical assistant in hair transplant where I was literally transplanting hundreds of individual grafts every single day. Another role was, again, the medical scribe role, and then also I was an MA in ophtho. In this medical assistant position, it was definitely a lot of hands-on direct patient care. I was rooming all of the patients, checking their eyesight, visual acuity, doing their visual field tests, very hands-on, definitely counted as direct patient care. And then last but not least, I'm going to touch a little bit on healthcare experience. I did have a lot of research hours that I accumulated, and in none of the projects did I have face-to-face encounters with patients. It was all on the computer, looking at charts or reading the literature. So that definitely counted as healthcare experience, not patient care experience. And then shadowing also fell under this category because, again, you're not supposed to touch the patient, you're just supposed to observe. And then last but not least is volunteering at local hospitals and nursing homes because we weren't really involved in any patient care. We were just kind of there for support and to spend time with the patients. So hopefully that was helpful. Feel free to use this as a resource while you're applying to PA school. And again, if you have any other questions as to whether something actually counts as PCE or HCE, feel free to check out the link below on my website. You'll see a much larger list of positions that go into each category. So I'll see you in my next video. Take care.